Over the last 24 hours, we have identified 1,828 new cases of COVID-19 in Alberta and completed about 17,200 tests. Our provincial positivity rate has risen to 10.5%, and we now have 18,243 active cases. This positivity rate is a grim milestone and one that should concern us all. There are 533 people in hospital, including 99 who have been admitted to the ICU. Sadly, there were 15 deaths related to COVID-19 reported to us in the past 24 hours. I want to share my deepest condolences with the family and friends of these individuals. Grieving the loss of a loved one is never easy, and I know the challenges and restrictions of this virus make it even more difficult. In schools, there are currently active alerts or outbreaks in 415 schools, about 18% of all schools in Alberta. Currently, they have a combined total of 1,581 active cases. This number includes 221 schools with outbreaks, including 99 currently on the watch list. We are heading into the first weekend of December. In a difficult year, I know this last month may be the toughest for many. This virus can spread quickly from one to many. In a month usually marked by festive gatherings, we feel the restrictions more keenly. But I want to stress the seriousness of the rising case numbers that we are seeing and how crucial it is that we reduce the spread and bend the curve back down. Earlier this week, I was reminded of the remarkable work that many Albertans are doing to support each other in this difficult time. Groups like the YEG Community Response Group in Edmonton and the YYC COVID-19 Volunteers Group in Calgary, both of which have done amazing work using Facebook to help connect people with free food, walkers, and other supplies and resources throughout the pandemic. Or the folks in St. Albert who groomed the walking trails and made the main paths more than 6 feet wide to allow people to pass safely while they're out getting some fresh air and exercise. I've also heard about many initiatives across the province that are connecting generous donors with seniors to provide cards and small gifts during the holidays. A meaningful gesture to remind those who have been most impacted by the pandemic that they matter. Millions of Albertans have risen to the challenge and are working very hard to limit the spread and to support each other. Today, I want to say thank you to everyone who is following the health measures and going above and beyond to prevent the spread. You are the majority in our province. This weekend, we need you to keep doing what you have been doing. If you have not been following the rules, or if you know that your behavior could be a little safer, this is the weekend to change it. This is the time for staying home and staying safe. If you do meet people, meet outdoors if you can, and maintain physical distance. Avoid anywhere with crowds. This includes shopping at less crowded times and using local curbside pickup shopping when you can. These are just a few examples. In fact, I want to issue a challenge to all Albertans this weekend. A challenge to fully embrace not just the specifics of the measures, but also the spirit of them, which is to reduce as many in-person interactions with people outside of your household as possible.
As part of our contingency planning, we have developed plans to create low-acuity, inpatient mobile medical units in both Calgary and Edmonton. While there is not a current need, it is clear that Alberta's healthcare system is under significant stress given the increasing numbers of COVID-19 cases in the province, and AHS must prepare for all scenarios. This plan is part of our ongoing, proactive pandemic response planning and is one of several initiatives that will ensure our healthcare system can meet increased demand caused by COVID-19. We are also trying to maintain a balance of continuing to provide non-COVID-related care to Albertans. Throughout our response to the COVID-19 pandemic, AHS has proactively planned for all scenarios, ensured we have access to all resources available, both within and external to the organization. Additional beds in a mobile medical unit would be used for low acuity patients or vulnerable populations who need low acuity health care. These may be patients who are stable and on the road to recovery, but aren't quite ready to be discharged home. Having these mobile units would help reduce demand on our in-hospital acute care beds and teams. No formal agreements have been made. However, we are in discussions with several external organizations to identify potential partnerships. We have continued to enhance our contact tracing teams to meet demand, and we have currently about 50 contact tracers pre-pandemic. We increased this to 5 times by July to 300 and more than doubled it again to September to 700. We now have more than 900 contact tracers in Alberta and are on track to double it once more, bringing us to over 1,800 contact tracers by the end of 2020. This means that we will have 36 contact tracers per 100,000 people, which will be on par or better compared to other provinces. We're also in the process of placing offers, onboarding, and scheduling orientation for the 500 additional staff.
If capacity limits are being followed, if individuals are maintaining 2 meters or 6 feet of distance between each other at all times. Ideally, everyone, of course, at this point in time with the restrictions in Calgary and Edmonton would be wearing masks when in those indoor places that are workspaces for many. Those are the kinds of things that can help mitigate the risks. But as I said just a few minutes ago, the absolute safest thing to do this weekend is to consider whether you can go in off hours where there's less crowds, call ahead and consider some kind of a curbside pickup option. And ultimately, again, this is a responsibility of the operators of malls, the operators of retail stores, and the Albertans who attend there collectively to keep these places as safe as possible.